No.
Okay. Thank you so much for that question. I think that that's a really important piece that we don't always talk about, which is the importance of advocacy. Certainly sometimes when I'm around other professionals, I hear a lot of, well, I don't have time to advocate, but we must. We have to advocate. Certainly I think our clients are experts in terms of identifying some of the systemic barriers that they're encountering, and listening to their stories and trying to create that time to actually listen to their stories, whether that be just a minute, 5 minutes. I usually dedicate my first hour of interaction with a person to just listen to them and their story. But helping them or have them identify some of those barriers and then seeing where we can affect change. Sometimes we're up against major barriers. It might be funding, it might be government, whatever it is. And sometimes the only thing that we can do is to validate what the person's experiencing, and to just provide a supportive ear. And then maybe even just provide some suggestions of how they might be able to find other ways to work around those barriers. So, for example, if it's food insecurity, are there some, in Winnipeg we have a food bank that's specific for people living with HIV. We have this wonderful resource that says Eat Free in Winnipeg every day of the week. So maybe just trying to network with other professionals and find resources that are already in the community to help them address some of the smaller issues. Like I said, sometimes we're not able to attack those larger issues of poverty. Poverty is huge. Right, and I wish I could say that we could solve that very easily, but we can't. But again, we can break it down into something more manageable. And even if you haven't had huge changes for that individual, even that moment of time to just listen to them and their experience, I think, has been very important for many of our clients.
And thank you for that question. And I think more and more in schools, we're training our students to be advocates, right? Because it's not something that we traditionally thought about as part of our role. So I think it really is important to think about the social determinants of health and what's our role in trying to promote and advocate for our patients and clients. So I think in the interest of time, we're going to move on to our last panelist. I'll turn it over to Larry.
And our last panelist is the person who started it off this morning. Staff physician here at St. Michael's, Gord Arbus. And Gord, when we listened to you, Greg, he developed really a very interprofessional approach to the type of care that he wanted. But I'm wondering, from a systems point of view, what can be done to support this interprofessional approach of care?
Yeah, that's a very challenging question, and I think that's the question everyone asks. And firstly, I wanted to thank Greg for his honesty and his perspective and insights. And he spoke about resources, how he's aging successfully because of the resources that he's been blessed to have and the supports. And I think we need to acknowledge right up front that each individual is different, each client is different, and for a lot of people, unfortunately, they don't have a lot of resources, they don't have a lot of supports, and each community is different. So I'm going to speak very briefly, because I know it's late, about the resources I have at my disposal where I work, and similar to Dawn, we're very fortunate to have a lot of these resources, but we need to acknowledge that there are certain communities that don't have a lot of these resources. So first I'll speak about sort of the bonanza that I have in terms of where I work, and then I'll talk briefly about how perhaps we could share and how we are sort of sharing some of what we have with other communities and other providers. So I work just up the street here. It's a wonderful facility. I get to work with a lot of wonderful people, so physicians, nurses, nurse practitioners, pharmacists, dietitians, physiotherapists, pharmacists, chiropodists. You want your feet looked after, we can get your feet looked after. We just discussed the social determinants of health, which sort of intersects with everything that we do. So we even have an income security health promoter, someone who's working full-time to work with our clients to sort of say, wait a minute, can we get you some more money each month? Or have you thought about applying for this? Have you thought of applying for that? And that's in-house. We even have a legal person, health justice person, so if there's legal issues. And so the social determinants of health and poverty, yes, it's daunting, but we have some practical things that we work with our clients to sort of help them with. And we also have, mental health and addiction is also something that intersects with almost everyone that we see, and the morbidity and the polypharmacy. And so we have mental health groups, and so even though we have psychologists and social workers that may work one-on-one, we've made a lot of success with our clients who get to work in groups, to do mindfulness, for example, chronic pain group, anxiety and mood, smoking cessation. And the feedback I get from clients is, you know what, it's really wonderful to work with other people who are going through similar situations. Obviously, groups aren't for everybody. I recognize that. But groups have really, in people who I thought this isn't going to work well, they come back and say, when's the next group? When can I participate in the next group? So it's really wonderful to see that. So the question is, and then there's certain things that we do to involve the patient, which I think is crucial. And let's not forget that. So from day one, when our clients enter into our care, we do a patient survey, and we have them do that once a year. And that's to gather information, get their input, and we really use their input to try and change the scope of care. And so we look at patterns in terms of their feedback and try and adjust accordingly. And the other thing we do every morning is what's called a team huddle. So everyone who's in the clinic that day, every healthcare provider, and it's all a huge team, we chat for about 10, 15 minutes very informally about what's going on today in the clinic, who's coming in, what should we know about the clients coming in, what can we do, who might we need to ask for extra help because someone is coming in and there might be a crisis. And so we're always talking about clients every single day with this team huddle. And then we also have a team meeting, which we hold once a week, which is a more formal type meeting. So I know I've spoken a lot about what we have. And then the question is, well, wait a minute, how do we, if you're living in Thunder Bay or if you're living in Manitoulin Island, how do we get some of that stuff, right? So what we're trying to do is mentor. And so we do a lot of training because we're a teaching center. So we do a lot of training of nurse practitioners and physicians and other healthcare providers to sort of say, this is what we do, and we'd love to help you try and do this elsewhere. So we do that in a mentoring role, and I take phone calls and emails all the time, and Skype and other technologies that you need to use to help share what we have, because funding is we're probably not going to get more funding than what we have right now, at least in Canada, or in this province at least. I think we've probably reached the peak, I think, for what we have. So we have to kind of say, it's great, let's solve the problems by giving more money, but I don't think that's going to happen. So then you have to be innovative and say, well, how are we going to use the funds that we have and share it around? And then there's, other controversial things that exist, like the LHINs, these integrative health networks, which some people don't like. But I think that where we work, we're actually the center point of the LHIN in central Toronto. So what's happening is we're able to share the resources we have with other physicians in the community that work, let's say, one or two physicians in their own office. They don't have any of this stuff. So their clients are able to use some of our services, even though they're not patients formally of our service. So I think that's another sort of tool that we can use. We also now have a patient navigator, which is amazing, right? Because he can not only find new patients out there who haven't been able to engage in care, but he also takes our own clients who, wait, where did this patient go? Where did this client go? We haven't seen them for a year and a half. And he will chase down these patients and clients and get them engaged back in care. So it's sort of linking new patients to care, because unfortunately there are lots of new patients, some young, some old. He's also working with our hard-to-reach populations. Just saw an 82-year-old patient of mine. I kind of fell off the radar screen. I hadn't seen him for 4 years. And he was living literally in his apartment, hadn't left his apartment in 4 years. And we didn't know that. So it's wonderful to have a resource to kind of find these people and bring them back. So that's all I'll say. Thank you.
Thanks very much, Gord.